Hi, good morning. My name is Kike, your host today on the podcast White Reflections by Hadufe. White Reflections by Hadufe is a podcast that delves into the complexities of life and modern day family life dynamics. As you all know, on White Reflections, what we do is we try to bring people with real life experiences to come share the experience with us. Perhaps somebody going through something similar can benefit from it. We also bring experts on the show to come share the wealth of knowledge with us. Perhaps also somebody going through something similar can benefit from it. On the coffee table chair this morning is Dr. Idowu Ayoluwa Elizabeth, a consultant radiologist, University College Hospital, UCH. Together this morning, we shall be talking about breast cancer, the biology of the disease, the survivorship rate, medication, treatment, and everything about breast cancer, the myth and the facts. Good morning, Dr. Idowu.
Good morning. I'm happy to be here.
Thank you so much. Thanks for coming.
Thank you.
I'm so happy. To have you here this morning. I've wanted to do this interview. I know you're so huge on the Pink Month, the October Pink Month thing, and I really wanted this interview before, the end of October. Thank you, Dr. Idowu. I'm not a survivor, but I've, had certain experience that I will be sharing on the show this morning. And I'd like you to debunk some of the myths, or perhaps, should I say, rumors, and then, of course, the facts behind breast cancer. First and foremost, Dr. Idowu, what inspired you, aside being a doctor and a radiologist? What inspired that passion? What fueled that passion?
Thank you so much. Well, the passion is, right from when I was 7, I'd had this desire to become a medical doctor, to help people. That's the passion. Helping people is my desire. That I love helping people. So seeing people suffer, seeing people go through a lot, there are so many things that you could actually do which will help you, but because of ignorance, a lot of people, they go through that process. So if you know a lot, I'm sure you won't go through that the line of ignorance. Even the word of God says that my people perish because of lack of knowledge. So if you know what every woman should have power in her hand. So once you are knowledgeable, you'll be able to take care of your health and be able to live a very long life. And my mother-in-law happens to be a survivor. She's like 35 years post breast cancer, and she's still alive. So I believe that breast cancer is not a death sentence. So it's when you take hold of your health in your hand, then you can pursue whatever you want to pursue in life.
Thank you very much. And I quite agree with that. And I also feel that you need to understand your body to a large extent.
Yes.
I'll tell you my story. Few years back, about 6-7 years back, I just found myself fondling with my breast. I wasn't looking for anything because I wasn't so, well informed about breast cancer. Okay. So I was just in the room, I was fondling with my breast, and I felt something on my right breast, actually. I felt something. And that night, I remember going to the other breast to see if the same thing I felt on the right breast was on the left breast. But of course, it wasn't there. So I ran out of the room. I went to my mom's room and I showed her. I said, "Mom, can you feel this?" She felt it and she said, "Oh, Mom." And she said, "Oh, I can't feel anything. It feels like a normal breast tissue and all of that." So I went back to bed. About a month after, I was just doing something randomly, and my hand hit my breast, and I still felt that thing, And this time around, it was more of my intuition telling me that there's something there. And that's the part of you understanding your body.
Yeah.
I was, coming to. Okay, so my question now is, do you agree with me that you need to understand your body first and foremost?
Yes.
As a doctor?
Yes, you need to. And that's the essence of the self-breast examination that you have to do every month. If you don't understand your breast, you would always feel there's something wrong with your breast. But if you understand your breast, you'll be able to say, okay, this is what is not, this wasn't there last month. Then you will know that, okay, something is different. So, but if you do your self breast examination every month, it should be done every month. So every woman should take care of her breast, should feel her breast. Between day 3 to day 5 after your menses, you go in front of your mirror, check, undress, go topless, look at your breast. Both breasts, they must look similar. Usually God has made us, we have two parts, to our body. So we have two breasts, especially people with, there are two breasts there. So once you check, you look at, first is the looking. You have to look at them. They must look the same. Sometimes one might feel slightly bigger than the other, but there shouldn't be obvious difference. So when you look at your breast, you look at the skin over your breast, you look at the nipples. Are both nipples out? Not that one is inverted and the other one is out. You look at it, is there any fluid coming out? You look at it, is there any color change? So all those, is there any dimpling? So all those signs, you must look at them. You must see that, okay, this breast, they look fine. And when you look at them, you also raise your hands up, both hands up. Those breasts, they must rise with the hand as they go up. So if one is diseased, one is going to be weighed down, because if there's a lump inside it, the other breast will sink, so to say. It won't rise with the other one that is fine. So you have to look. Then you can also place your hands on your hip, like what we call akimbo. So when you put your hands on your hip, your breast too must come out, and then they must also still feel and then look the same. And then you can tilt a little forward, and those breasts too, they must come forward as you move forward the same way. So you must look at your breast every month and see that there are no changes there. So, and then when you are done with that, that's when you can either stay standing. You can do this in your shower or lie on your bed. However, when you lie on bed, you have to place a pillow, on the shoulder, on the shoulder the breast you want to examine, and then use the other hand to palpate. We call it palpate, but feel. That's the layman's language. You feel the breast. So there are about 3 patterns that you can use. We have what we call the swirl pattern. We have the clock. That's the face of the clock. And then that one is also called the wedge or the pie pattern. So you divide your breast into a clock or into wedges, maybe of 4 quadrants. Then you feel your breast, but you must choose a pattern to follow every month. And sometimes you have the circular one, that you can go round. You start from the nipple, then go round the collarbone. You go round. Then you must not forget your axilla. You must feel, because sometimes lumps, we have seen a lot of women coming with lumps in the axilla, in their armpit, and there is no lump in the breast. So you must
How
not
can you differentiate a lump from a boil? Because I know a number of women do have boils in the armpits, and then you can't. How do you know if it's a lump or it's a boil?
Well, boil is, it's superficial. It's in the skin.
Okay.
So, but something deep within. But then you should be careful. If you start having boils every now and then, you should get your armpit checked, because you shouldn't be getting lumps every now and then unless you're shaving. And shaving can give you some bruises, some cuts that you can also have what we call folliculitis actually. Mm-hmm. So many times it might just be because of the shaving of the armpit now and over now and then. So it's the skin. But the lump we're talking about is deep. We have some nodes there that God has given us. If you are shaving too, you can also feel some nodes. So when you palpate the node, they feel like bean. They are actually bean shaped. Our regular bean, they're actually bean shaped, but the lump that we're talking about will be hard. Usually lumps that are cancerous are usually hard, and sometimes you don't feel anything. So that's why it's always good when you feel by yourself. Of course, you've known your breast, you know how your breast feels like. You should always come to the hospital when you are less than 40. you come 2 to 3 years for a health professional to also feel, a trained health professional to also feel your breast for you.
Thank you very much, doctor. I'm going to stop you right there.
Okay.
I love the fact that you talked about a trained health professional, and I'm going to continue my story. So, of course, a month after, when I felt this thing randomly, my intuition said to me, "There's something here, Kike, and you must get it checked out." So, I mean, this time around, I just took it upon myself, and I'm sharing this because of the number of misdiagnoses that we've had, and I want to bring it back to, do we have, I'm sorry, I'm not trying to undermine the health sector or the health professionals that we have, but do we have trained health professionals? Because doctor, that day I went to about 3-4 hospitals, and I mean the nurses there, the midwives there checked me. In fact, the last one was what put me off, because the way she was checking, I wasn't even comfortable. But I'm saying this because I know a number of people who have been through this experience as well, and who, as a matter of fact, made early presentation but were misdiagnosed along the line. Okay, so I went to about 4 hospitals, and they kept checking. They kept telling me that
Nothing was
there was nothing there. But because I knew what I felt, and my intuition kept saying to me that there's something here, you need to just get this checked out, fully. So the last hospital that I went to, and I'm not going to mention names, fortunately for me, my friend was on duty. She's a doctor. And she was actually the doctor on duty that day. So I went into her office and I said to her, you know what? I felt this thing before, and I'm still feeling it now. And I mean, I feel, that there's something there. Even though I've been to 4 hospitals, I still feel there's something there. And she said, you know what? Lie down and take me to where you felt it. Those were her exact words that day. She said, you know your body. Just take my hand to where you felt it. And I took her hand there. And it was at that point she wrote a scan. She said, you know what? Go and have a scan done. And I had the scan done. Before I continue my story, I want you to talk about misdiagnosis with people who present their cases early enough.
Well, thank you very much. Well, on that note, that was why I said trained health professionals. You cannot rule out meeting quacks, meeting, people that don't know what they are doing. But if you as a woman, you have the power in your hands, you're not satisfied, like you did, move to somewhere else. And then you must go to accredited places. A lot of people will just go to some, places, they might just say, oh, hospital. But then when you look at the place, you would be shocked. So I would advise every woman to go to accredited places.
So when you say accredited places, doctor, what kind of hospitals? Do you mean teaching hospitals?
Well, we can have health centers that are accredited, and then most times when you see health professionals, you will know, for example, somebody that just told you, take me to where you are. So many times when you meet people, when they talk, you will actually know what exactly this person is up to. When you feel uncomfortable, you can move away. And I would advise health professionals, if it's not your field, if you know you cannot prefer solution to the person's problem, refer. Refer.
Thank you.
If that's too much for you, like, oh, okay, I don't know what this is, but I'm going to refer you to somebody that can take care of you. So and that's why we have primary health care, secondary health care, and tertiary health care. Teaching hospital is a tertiary health care. So really, a lot of people shouldn't be coming to tertiary hospital when they've left the secondary. So primary, yes, you're supposed to go there, but if you think that, oh, this is beyond me, then refer. So you don't just keep your patients, in the dark. And if you think, oh, okay, maybe I'll tell you to go and do a scan. You don't have to go to a tertiary hospital for somebody to write a scan for you. You can also write a request, even if you think, oh, okay, this person might not benefit there's nothing wrong in doing a scan, especially when you're less than 40. You can actually come. Oh, I think even you can walk into a tertiary hospital and say, I would like to get my breast scanned, even without a doctor's request. You can. So you can come into, for example, my department. A lot of people come in and say, oh, I would like to get my breast checked. I would like to get my breast scanned.
And exposing your breast to scan, it doesn't
No,
pose
it's
any
not.
health.
No,
Okay.
it's not. It's not ionizing radiation. Just like doing scan for a pregnant woman. So they're just ultrasound. The waves, it's just sound frequencies. Do you understand? So it has nothing. Though it is not a screening tool, but then we can actually see, okay, whatever that is going on. For example, the time that you felt, oh, there was something in your breast, you could have just done a scan and then, know what's there. So if you're older than 40, every woman older, once you're 40, I advise my friend, when we do the 40 celebration, go and do a mammo.
But I hear, okay, I'm going to stop now. I don't want to ask you that question yet because I want to finish my story. Okay, so I went to the hospital right immediately. She ordered the scan, like I said, and I had the scan done. And I remember is the radiologist now saying to me that the first question he asked was, who found this? It was at that point I realized that, oh, it's actually there. And that was a rude shock, I was praying while I was there that, oh,
They won't find
anything. But the first question he asked was, who found this? And I said, is there something there? And he said, yes, there's something there. But it's very small. Who found it? And at that point, I started crying. I started crying, because I just thought cancer. That was what came to my mind. Like I said, I wasn't well informed about it. I don't think I've had anybody, come down with breast cancer before. Even though now I know a few people, a few friends that, But then, so I just started crying. And he said, why are you crying? He said, because you found something. And he said to me, it doesn't matter. But I wouldn't hear. I wasn't even going to hear anything. The fact that he said he found something. And he said it was very small. So I went back to my friend, still in tears. I was a mess. I was just crying. And she was looking at me. Why are you crying? It is not. They found something there. I mean,
it's not cancer.
It's not cancer. And I'm like, what do you mean? They found something there. And she said, not all lumps
are cancerous.
That was the first time I was going to hear that, And I was, after the whole experience, I said to myself, as a woman, you need, not even as a woman, as an individual, you need to seek knowledge. You need to know more about these things, because if you do not, I felt I really made a mess of myself anyways. But so now, not all lumps are cancerous. Please, I need you to talk about that before I continue my story.
Okay, so not all lumps are cancerous because we have what we call benign and malignant lumps. Mass, we call them masses. Layman will say lumps, but we say benign. Benign means that they don't have the features of turning into breast cancer. And when we say malignant, they have all the features. Because I'm a radiologist, that's what I'm talking about. So on imaging, when you do ultrasound or you do a mammogram, there are certain features, there are certain things that we look out for us to say, okay, we can classify this lump as benign, that is, it is not cancer, or malignant. And many times there could be some lumps that may be indeterminate. That is, they can look like they are benign. At the same time, they might have a feature that may look like it is malignant. So in that situation, we do biopsy. Biopsy is when we use needle.
Aspiration.
Well, yes, you can do aspiration. That's fine needle biopsy or cytology. That's aspiration. You can do that. or we have what we call guided core biopsy, ultrasound guided core biopsy. Through ultrasound, when we use the machine, we have this needle. The core is very sharp, which can take tissue. That is more sensitive than the aspiration. The aspiration will just tell you it's either a benign or malignant cell. But the biopsy will tell you what exactly it is. Will tell you the diagnosis, like what kind of cell that is. Aspiration will say it is either benign or malignant, but biopsy, the tissue, is going to tell you, okay, this is it. It's benign though, but this is it. It's fibroadenoma. I'm starting to mention some benign stuff. It could be fibroadenoma. It could be a cyst, breast cyst. There are a lot of women form cysts in their breast.
So the fibroadenoma, what does it is a benign lump?
It's benign.
Okay.
So it's benign. So a lot of women, they have fibroadenoma. In fact, a lot of women grow with the fibroadenoma. Sometimes it will become calcified, what we call involuted fibroadenoma, that it will be like a stone in their breast. So a lot of people carry it around, does not harm them. Sometimes some other people may talk about pain, occasional pain, menstrual related to their menses, but it doesn't hurt, it doesn't cause them any harm. So sometimes some people, because of aesthetic, like I don't like the way, because it could really be big, that it could be alarming, like sometimes you can see one that can be 5 cm, you call it huge fibroadenoma, and then it can disfigure
the breast.
So
you just want to
get it out, especially if a woman is not married, if breast is disfigured and all that. So for the aesthetic, a lot of women take it out. But if you are very small and it's confirmed, it's benign, you can leave it.
Thank you, doctor. I'm going to come to that. There's a myth. I don't know if it's a myth or is a fact.
Okay.
Okay, I'm going to continue my story up until that point of the biopsy. Okay, so when I took the result back, I was given 2 options: remove or do a fine needle biopsy, aspiration or whatever it is. And of course, my parents, they were a mess. My mom, she had started, traditional this, traditional that. She's going to kill me if she ever watches this interview. But then I remember the next day she took me to one of her friends who happens to be into herbs and all of that. And they started saying so many things. And I said to myself, no, I'm not going this route, And I remember the doctor, I may not want to mention his name. I remember my doctor saying to me that I will not have you take the risk of a fine needle aspiration. If it's there, Kike, you're getting it out. Those were his words. And I'm like, why, doctor? He said, because if it's a foreign, if it's there, you would, emotionally, psychologically, something is there. It's going to affect you. That's one. Then 2, we need to get it out to know what it is. So I'm not going to have you go down the route of fine needle aspiration. Yes. And there's a myth behind the fine needle biopsy. That if it's an aggressive, what's it called?
If it's cancerous.
If it's cancerous, and especially if it's the aggressive type, once the needle aspiration is done, it's going to spread. Is that true?
Well, I would say true and not true. Actually, when you get something, fine needle is not, that was the first thing I said, not diagnostic. Fine needle will just say if it is benign or malignant. So if you do, and for you to have, if it's malignant, the treatment options depend on the chemistry, we call it immunochemistry, of that tumor, of that lump. So without taking out tissue from that lump, you will not know how to treat that patient. So there's no way. You want to know, you have to get it out, either by excision. Excision means go through surgery. You have to go through a lot.
So I'm saying if you get it out by surgery, through surgery, is it a safer option than
if you go through surgery? There are some treatment options, like if you have to if you don't have to go through surgery first. Sometimes you can just be given chemotherapy before you go to surgery.
Okay.
What we call neoadjuvant chemotherapy.
Okay. So that's new.
Yes,
that's
that's
a new line of-
new.
New, okay.
So afterwards, that's when you say adjuvant chemotherapy. So the treatment option, the treatment for that cancer, for that lump, depends on them sending it to the pathologist to look at we have what we call hormone receptors. You know, sometimes some of these lumps, they can be classified based on what they express. So if they do not take it out and go and check, for example, you can't give the chemotherapy you give to a triple negative woman to a triple positive woman. So those are the hormone that the lump, the receptor they are showing. So it depends on the tissue. So it's not fine needle. You need a biopsy. That's the core. And the core is the one that will give you that details. Fine needle won't give you details. Fine needle will just say, oh, it's benign cell. Okay, it's malignant cell. So you have to go forward. That's another step, to do a core biopsy, a needle core biopsy that is going to take tissue out. That tissue is very important for the treatment. So it is very, very important. So it depends, and then you have to go to a trained professional, because if they don't do it well, like you are saying that, okay, it can make it spread and all that. Yeah, because yes, but then the treatment of that lump is dependent on their tissue diagnosis and the immunochemistry that they will perform on that tissue that they have taken out. A lot of, in fact, there's so many. Then the study that has gone ahead, a lot of people at molecular, they have done some even up to the molecular level, you know, to know the character of a particular lump. There's a lot of study going on, clinical trials, you know, so it's not a death sentence. So when they get the tissue out to go, okay, it's benign, okay, it's fibroadenoma, okay, then you can rest. If you don't do that, that means you have to go through surgery for them to take it out. And then a lot of surgeons are afraid that, oh, okay, I don't want to take it. What if it is cancerous? So if it's cancerous and the treatment is you have to do a mastectomy, like you have to remove the breast. So why go twice?
Okay.
So you don't have to go twice. So just do the tissue biopsy, you know, just do that biopsy. It's very tiny, just like a pinprick. Just go in, needle, you see the needle, just go in, just small. And that's it. Not everybody does it. So it has to be done by a professional. You cannot just see anybody in the street saying they want to do biopsy. No. So the way we're going to do it is not going to make it like, okay, it's going to make it spread. No, because what you don't even know whether it has spreaded. And that's the stages of breast cancer. So at diagnosis, you want to know the extent of the disease. So without that, you cannot know. When you don't do imaging, you will not know. With eyes, you cannot see things. So it's only when you do imaging, okay, then you see, okay, the lymph nodes, they are normal, okay, but then you can still have micrometastasis that even imaging cannot pick at that time.
Except
yes. Except the pathology.
Okay, but well, in my own case, I had it removed, and of course, thankfully, it was a benign lump. And I remember saying to myself, you know, after the whole experience, it was a very emotional one for me, and you know, it was almost as if I had survived something, you know, even though it wasn't in the real sense of it, you know, and ever since then, the trauma is still there. There are times I just don't want to go near my breast, you know. There are times I just feel, oh, I'm feeling something, and I'm not actually feeling anything. It's just the mind or a psychological thing. And then I'm thinking of people who have actually had cancer, people who have been through it. I'm sure you've met a lot. These days, we've seen a number of young, I mean, in those days, it used to be 50, older than 50, you know. But these days, I remember a particular lady who passed away recently of breast cancer. She was about 34. So, I mean, why are younger women? What are the risk factors?
Yes, because that's what I want to say. That for us to understand breast cancer, the breast is actually made up of components, the lobules, and then the ducts. So the lobules are the glands which produce the milk. The ducts are the one that transport the milk, to the nipple where it's needed. So if any of these components, the cells in any of these components is diseased, that's when you say lobular carcinoma or ductal carcinoma. So we have the breast cancer. There's no known cause, really. We say it's multifactorial. It's a lot of factors put together. In fact, we have risk factors. We have what we call modifiable risk factors, and we have the non-modifiable risk factors. The modifiable ones are the ones we can do something about. The non-modifiable risk factors are the ones we cannot do anything about them. Being a woman, you cannot do anything about it. God has made you to be a woman. So being a woman is a risk factor. So breast cancer can be seen in men too, but it's very rare. So, but because it's 100 times commoner in women than men, age, as a woman increases in age, her risk also increases. Race and ethnicity. It's said that whites, they are slightly more likely to have breast cancer compared to the African American women. However, the African American woman is likely to die from the breast cancer because they have more aggressive type of breast cancer. And you have the Hispanic, you have the Asian. They are not likely to have breast cancer or to die from breast cancer. So it's risk factor. So being an African woman, and then the Native American, with the Asian, Hispanic, they are less likely to have breast cancer. So you would see that. I mean, we don't know why, but we know that in them, probably because of what they eat, and that's the modifiable risk factors. That brings me to the modifiable risk factors: our diet, sedentary lifestyle, what we expose ourselves to. Sometimes a woman will decide, I don't want to have babies. Being pregnant and nursing a child, breastfeeding protects you from breast cancer because of estrogen, the hormones that is, working on the breast monthly. So being pregnant is going to, reduce all that, and then nursing a child, because it's oxytocin that'll be the hormone that will be the order of the day, not the estrogen and the progesterone. So these are things that protect us as a woman. So some women will say, oh, no, I don't want my breast to sag. No. You protect yourself by nursing your child. So there's so many things that we expose ourselves to. Genetic factors. Some women, they get it from their parents, either from the mother or from the father. You cannot change that. Hereditary, that's the genetics. So we have some defective gene that is transferred to a particular woman. Then we positive family history of breast cancer. If you have one, it has doubled your risk as a woman. If you now have two, it has tripled it. So then we have what else do we have? We can have some benign breast lesions that could also predispose you to breast cancer,
like
atypical hyperplasia. We have the lobular carcinoma in situ, which is not actually cancer, but at the end of the day can predispose that woman to breast cancer. So there's so many things. You must exercise. Those are the things that will protect us. Lack of sleep. Those are, there's so many things these days. This country now, a lot of things are happening. The
lack of sleep.
Yes, lack of sleep. Sleep is very good. It's very vital. Though my husband fights me, like I don't sleep a lot too, because so many things I tend to do in the night and all that. actually it's been proven, lack of sleep. Sleep regenerates your cells, it heals you. It's like a medication. It's good for your brain, good for every part of your body, to regenerate itself. Do you understand? So lack of sleep. So a lot of all these risk factors that we expose ourselves to that can predispose a woman to breast cancer. Diet, high fatty food. A lot of people go with junk food, because you are very busy, career woman, you cannot cook. Let me just grab something, grab burger, grab this. So those are the things that are predisposing us. Sedentary lifestyle, not exercising. Exercise, it has been proven. Exercise and breast cancer, it does reduce the risk of breast cancer. It does. So we must take hold of our health. So these are all these factors. I say, so about 8 or 9 of them, if I begin to rattle them, things that predispose. Is it early menarche? You cannot do anything about it. Early menarche means that the first time a woman starts menstruating, sometimes a woman can start menstruating at 9. That's early. And then can have late menopause. That's a whole long time that your breast is being exposed to estrogen and progesterone. So you can't do anything about those ones. But the ones you can do something about them. Sleep well, eat good food, grains, vegetables, reduce the fat intake, exercise more, check your breast, do self-breast examination monthly. If you're over 40, once in a year, come to a trained health professional, do your mammo. Those are the things that will make your breast.
So if you're over 40, you have to do a mammogram, you said.
Please.
And I heard that mammogram also, I don't know if this is a factor in me, it exposes you more to breast cancer. How true is that?
No, it's not. It's a low dose X-ray that it uses. That's why it's not recommended for women less than 40, unless you have a positive family history of breast cancer, that we recommend that you come in at 35. Actually, it depends on the age that the person that had breast cancer in the family had it. So usually it is recommended 10 years earlier that you start to screen, so that it is not the
That's
age.
if you have a positive family history.
For example, some people, they have we say that first degree, like mother, your sister, somebody, your blood relation really close to you, and then the second degree, your aunties, your uncle, you have to. So they are second degree, but first degree, your sister, mother to child. So those are the first degree. So when you have a first degree, and then you have that this trend is in the family. So, and then you want to know what age the person that had it. So we usually ask. Sometimes some people say, I don't know, I can't remember. I just know that, okay, they said she had breast cancer and that was, no. It's very important for you. You have to know your lineage. You have to get into the root. You have to know what killed grandmother, what killed great-grandmother. But they said she had something like a breast something. No. Because it's important. That history is important for you. Because the age she had it, you have to start screening 10 years earlier than the time. So many times we have recommendation, once a woman is 20, we say let her go for breast MRI. If there is a positive, and then we have risk. We have high risk, we have moderate risk, we have low risk. So it depends. Your health professional will be the one to classify, that, okay, that's when once you have up to 20% risk, my dear, you are high risk. So you should take care of your breast, take care of yourself. So you must know the age at which the people that had breast cancer in the family, when they had it. You would be surprised. But when you ask 1, 2, that it's around the same age, then you must start to screen 10
Get yourself checked
earlier,
10 years
before that
age. Thank you very much. So some myths, deodorants.
Well, it's not been proven, but we have some deodorant that we call antiperspirant. I actually don't like, because why won't you sweat? God has made everything for you to sweat. So sweat it out. I use the normal deodorant, not the antiperspirant.
What do you mean by the normal deodorant, like your Nivea?
Well, I don't want to mention.
Okay.
I don't want to mention
Okay,
brands.
brands now.
Yes,
Okay. I
brands
just had
now.
to because
But there are some that they are just perfumed one, not the antiperspirant. So I mean, you should sweat. Why won't you sweat? But just not you for you not to smell, have bad odor. So why don't you want to sweat? God has made you to sweat. Sweat is good. So just use the regular one, not all the antibiotics. Won't make you sweat and trap sweat,
Okay. On the wire, what's it called?
No, underwire bra.
Bra?
Nah.
Okay.
No,
So
they
what
don't.
else? We've had a lot. I don't know.
Yes,
We've
but
had a lot.
it's actually, well, some of the meat, like, okay, if your husband is touching your breast or if your husband is sucking your breast, it actually doesn't cause breast cancer. Or if you're wearing bra around and all that, no. Actually, well, it's good to take care of your breasts. The more a woman take care of her, that somebody is touching it, the more the person knows how that breast feels.
Okay. So you're recommending that
Yes.
they touch and suck.
Yes.
Thank you so much, doctor. Thank
You're
you.
welcome.
So when it comes to surviving breast cancer, the rate at which people survive it, can you take us on that?
Well, I think I mentioned it earlier. Is the stage of breast cancer? We have 5 stages: stage 0, 1, 2, 3, 4. So if a woman comes in at stage 0, you are rest assured that the woman is going to survive the breast cancer. So the earlier, the better.
And what do you recommend usually? Removal? Total removal?
Well, it depends on the surgeon. They are the ones that do that.
Yes, okay.
They are the ones that, treatment and all that. But once early detection, that's the key.
So stage
Because-
0?
Yes. About 99%.
99%. Stage 1?
Well, it reduces about 80, up to like, I think stage 4, like 26% or so.
So what do you mean by stage 0?
Stage 0, that the cancer is still contained. It has not gone beyond. I talked to you about lobules and ducts. So, for example, if it was a lobular carcinoma in situ, it's still within the lobule. It hasn't gone into the surrounding tissue. It is still where it is. It has not breached the basement membrane. I don't want to take us through all that. So, if it is duct, it's still within the duct. It's still contained. But if you now have one that has gone beyond where it was into the surrounding tissue, the stage has increased. So the stages now depends on the size of the lump and where it has gone to. If it has gone spread to the axilla, that's like to the armpit, that's like stage 2 already.
And I know people survive and then they go into remission.
Yes.
And then a few years after.
Well, that's why I talked about micrometastasis. That sometimes metastasis would have gone to some other places that we didn't see. And that's why in advanced countries, that's why in low income and middle income countries like ours, where we don't have easy access to medical facilities, so it's quite difficult. For example, abroad, I'm sure they will do all that PET CT, all those things that will make them to say for sure that there is no cancer cell anywhere
else
in your body. Because many times, yes, the doctor has tried, they've done that. What if it has gone, micrometastasis has gone to anywhere else in the body and you didn't know? And that is going to cause problem another time. So it is not because the woman didn't come early, but because it has spread, more than where it should be.
Thank you so much, doctor, for coming. I wish I could, stay and be with you forever to have this conversation. It's been so insightful and inspiring. So I'd like you to give our viewers something to take home with when it comes to the biology of the disease, how they can get treatment, what they can do, and the rate at which they can survive.
Yes, well, we've talked so much about breast cancer today. I would love every woman to take care of their breast. Do your self-breast examination monthly. 3 to 5 days after your menses, do your breast examination. If you're over 40, come once in a year for a trained medical personnel to check your breast. If you're over 40, come to hospital, come and do a mammogram. UCH is doing a 50% discount from now till end of December. You can take hold of that. Though we have a lot of issues now with power supply and all that, but then you can still call and then book for a mammogram at 50% discount till end of December. So every woman that is over 40 can take hold of this opportunity. So make sure you take care of your breast. If you are in doubt, talk to a medical personnel, a trained medical personnel for that matter. And you can also walk up into our department. I would like for my breast to be checked. Please take hold of your health in your hand, because early detection is the key.
Thank you so much. Thank you, Dr. Dole, for coming. Thank you, our viewers. I hope we've been able to explore all the angles when it comes to the biology of the disease called breast cancer. And you've heard it all from Dr. Idowu. She's a consultant radiologist, like I said, UCH Ibadan. And she has, given us all the expert information that we need. She has debunked most of the myths, and the fact still remains that if you know that you're at high risk of getting the disease, please get in to checking yourself on time and taking care of your health and your breast health as well. Thank you so much for watching. Till we see you next time. Bye for now.